Hi, this is Dr. Tanya Kormeili, board-certified dermatologist. Today we're going to talk about melasma. We often think about melasma as the mask of pregnancy, but often people can get melasma even when they're men, which means they never got pregnant. The truth is we know very little about the true reason people get melasma, but we do know that it's associated with hormonal imbalances, exposure to UV that causes some damage to the skin, and it can cause further discoloration as we try to remove this pigmentation. When it comes to melasma, less is always more. Now, people who have melasma are usually very sensitive to light. So when it comes to treating melasma, there are things you can take responsibility for that would greatly improve the outcome of any treatment you receive. Number one, sun protection. I'm not talking about the sun. Really what I'm talking about is UV exposure, because even on a cloudy day, there's still a very strong UV index that can work on your pigment cells to create exacerbation of the pigmentation. So things like sunscreen and healthy sun habits, which means do not go out in the peak sun hours, especially if you live like Los Angeles, very close to the equator. Very protective clothing, hats, making sure that if you're going for a walk, you're not walking on a surface like sand or concrete or asphalt where it can radiate back, so your hat is covering you, but you're getting irradiation from the floor back up to you. Anything you can do to minimize the UV exposure to your skin will help with melasma. Secondly, we can actually decrease the amount of pigment production in your skin in the area that we're treating. There are many ingredients that help brighten the skin. Some are prescription and some are botanical. And in combination, we can help brighten the skin and cause the amount of pigment you're generating to decrease, creating a brightening over time. You can also do what is called exfoliation. Exfoliation can be done with acids you use at home, products you can take at home, or it can be done through chemical peels that are medical grade rendered in the office. So in the treatment of melasma, we always want to change the UV exposure, decrease melanin production, and cause some kind of a brightening through a chemical peel before we attempt any lasers. A word of caution, a lot of patients who have melasma will respond really well to IPL and BBL, only to have exacerbation within a year where it comes back not just where they have it, but a lot worse everywhere. And we think that's because this type of skin is usually sensitive to light anyway. And so by using these lasers, you temporarily make the solution better, but it comes back with a vengeance. We only resort to IPL and BBL as the last resort when we have exhausted other more effective lasers and chemical peels. So if you're worried about your melasma, you don't like the way your skin looks, and you want to even out your complexion, come see me. I'm happy to help you achieve the best results for your skin.